Fever is a very common experience for almost everyone at some point in their lives. It can feel mysterious and sometimes a little bit frightening when our body temperature climbs higher than normal. However, it's important to remember that a fever itself is not an illness. Instead, it is a clear and significant sign that your body is actively responding to something unusual happening inside, such as an infection. Our bodies possess incredible, intricate mechanisms to protect us and communicate when things are amiss. Understanding fever as one of these vital signals can significantly reduce our anxiety and help us respond appropriately when it occurs. It's a natural, often helpful bodily process. The reason your body temperature rises during a fever is quite fascinating and involves a specific part of your brain. Deep inside your brain, there is a small but powerful control center called the hypothalamus. You can think of the hypothalamus as your body's internal thermostat, constantly working to keep your core temperature stable. When you get an infection from germs like bacteria or viruses, or when your body experiences certain types of inflammation, special chemical messengers called pyrogens are released into your bloodstream. These pyrogens travel to the hypothalamus and essentially tell it to turn up the heat, raising your body's normal temperature set point to a higher level. Once the hypothalamus has adjusted this temperature set point upwards, your body then diligently works to reach this new, warmer target. To generate more heat internally, your muscles might begin to contract and relax rapidly, which we experience as shivering. This muscular activity produces warmth. At the same time, your body will also try to conserve the heat it already has. It does this by constricting the blood vessels near the surface of your skin, especially in your hands and feet. This reduces the amount of heat that can escape, which is why your extremities might feel surprisingly cold even though your core temperature is rising. This carefully orchestrated increase in your body's temperature is not a malfunction. It is a deliberate and strategic defense mechanism. The elevated temperature creates an internal environment that is less welcoming for many of the microscopic invaders that can make us sick. Many types of bacteria and viruses, for instance, have a specific temperature range in which they grow and multiply most effectively. By raising the body's temperature, a fever can slow down their reproduction and make it harder for them to survive. This gives your immune system a valuable advantage in the fight against the infection, showcasing the sophisticated ways our bodies protect us. When harmful germs like bacteria or viruses manage to enter your body and start causing trouble, your immune system immediately springs into action. Think of your immune system as a highly organized and vigilant army, constantly patrolling and ready to defend your internal territory. A key part of this army is made up of specialized white blood cells, which are like the soldiers on the front lines. These cells are tasked with identifying the foreign invaders, attacking them, and eliminating them from your system. A fever developing is often one of the first clear indications that this internal army has been mobilized and is actively engaged in a battle against an infection. Interestingly, the higher body temperature associated with a fever can actually enhance the performance of your immune cells. It's almost like the fever provides a boost to your internal defenders, making them more effective in their fight. For example, some studies suggest that certain types of white blood cells can move more quickly to the site of an infection when your body temperature is elevated. They may also become more aggressive in their ability to engulf and destroy the invading germs. Furthermore, the increased temperature can stimulate the production of important immune substances, such as interferons, which play a crucial role in fighting off viral infections by interfering with viral replication. Beyond just boosting your immune cells, the elevated temperature of a fever directly makes the internal environment of your body less hospitable for the invading pathogens. Many common bacteria and viruses have evolved to thrive and reproduce most efficiently within a narrow temperature range, usually around normal body temperature. When a fever raises your body's core temperature even by a few degrees, it pushes these germs out of their comfort zone. This change can significantly slow down their rate of growth and multiplication. By doing so, the fever effectively buys your immune system more time and a better opportunity to gain control over the infection. While fever is a powerful and generally beneficial defense mechanism, it's important to recognize that it's part of a delicate balance within the body. The body usually does a good job of regulating the fever so it doesn't become excessively high. However, in some situations, particularly with very young infants, older adults, or individuals with severe underlying health conditions, a fever can climb to levels that might become harmful if not managed. This is why monitoring a fever, understanding its context, and knowing when its benefits might be outweighed by potential risks is so crucial for overall health and well-being. One of the most common early symptoms you might experience as a fever begins to develop is feeling cold or having chills, often accompanied by shivering. This can seem quite contradictory, as your internal body temperature is actually in the process of rising. The reason for this sensation is that your brain's thermostat, the hypothalamus, has been reset to a higher temperature. Your body, therefore, perceives its current normal temperature as being too cold relative to this new elevated set point. As a result, it initiates mechanisms like shivering rapid muscle contractions to generate more heat and help raise your core temperature to meet the new target. Later on in the course of a fever, you might find yourself starting to sweat profusely. This usually signals that the fever is breaking, which means your body's thermostat is being readjusted back down towards its normal level. Perhaps the underlying cause of the fever, like an infection, is starting to resolve, or medication is taking effect. With the set point lowered, your body now feels too hot. To cool itself down, it activates its natural cooling mechanism, sweating. As the sweat evaporates from the surface of your skin, it carries away excess heat, thereby helping to lower your body temperature back to a more comfortable range. The processes of fever, particularly sweating and sometimes faster breathing, can lead to a significant loss of body fluids. This makes dehydration a very real and important concern when you have a fever. It is absolutely crucial to make a conscious effort to drink plenty of fluids throughout the duration of the fever to replenish what is being lost. Water is always an excellent choice, but you can also opt for clear broths, diluted fruit juices, or oral rehydration solutions if needed. Maintaining good hydration helps your body function properly, supports your immune system, and can make you feel more comfortable overall while you are recovering. Beyond the noticeable chills and sweating, a fever is often accompanied by a range of other uncomfortable symptoms. You might develop a persistent headache or experience aches and pains in your muscles and joints, making you feel generally unwell. It's also very common to feel unusually tired, weak, or lethargic as your body is expending a great deal of energy to fight off the infection and manage the fever. Some individuals may also experience a loss of appetite. These are all part of your body's comprehensive response to the illness and the physiological changes caused by the fever itself, signaling the need for rest and care. For most healthy adults, a mild or low-grade fever may not necessarily require an immediate trip to the doctor's office and can often be managed at home. However, there are specific situations where seeking professional medical advice is very important. If your fever reaches a high temperature, generally considered to be 103 degrees Fahrenheit or above, it's wise to contact your doctor. Additionally, if a fever persists for more than 2 or 3 days without showing signs of improvement, a medical evaluation is recommended. Crucially, if the fever is accompanied by more severe symptoms such as difficulty breathing, significant chest pain, a very intense headache, unusual stiffness in the neck, confusion, or the appearance of a new skin rash, you should seek medical attention promptly. Fevers in children, especially in very young infants, can be a greater cause for concern and often warrant a more cautious approach. For any baby younger than 3 months old, any fever, typically defined as a rectal temperature of 100.4 degrees Fahrenheit or higher, should prompt an immediate call to the doctor or a visit to an urgent care facility. For older babies and children, you should contact their pediatrician if the fever is particularly high, if it doesn't respond to home care measures like appropriate medication, or if your child seems unusually irritable, lethargic, is refusing to drink fluids, or exhibits any other symptoms that worry you. Always trust your parental instincts. If you feel something is wrong, it's best to get professional advice. When managing a fever at home, there are several simple yet effective things you can do to help yourself or your child feel more comfortable while the body fights the infection. Ensuring adequate rest is paramount, as your body needs all its available energy to combat the illness. Drinking plenty of fluids such as water, clear broths, or diluted juices is essential to prevent dehydration. Wearing light, breathable clothing can help prevent overheating. A lukewarm sponge bath can also provide some comfort and help to gently cool the skin, but avoid using cold water, as this can cause shivering, which might actually increase the core body temperature. Over-the-counter, fever-reducing medications like acetaminophen or ibuprofen can be used according to package directions or your doctor's advice. It is important to remember that, in most cases, a fever is a positive indication that your body's sophisticated immune system is actively working to defend you against an infection. While the experience of having a fever can certainly be unpleasant, making you feel unwell and uncomfortable, it is often a natural and beneficial part of the healing process. By understanding what is happening inside your body, knowing how to manage the symptoms effectively at home, and recognizing the signs that indicate when it's time to seek medical attention, you can navigate a period of fever with greater confidence and support your body's remarkable ability to recover.